Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the difference between the high molecular weight or the unfractionated heparin and the low molecular weight heparin. You all know that heparin is one of the potent anticoagulant or blood thinner. So it prevents any kind of clot formation, or it stops the existing clots from growing larger. Okay, so this heparin is a most potent and widely used anticoagulant. Okay, so you will see that this heparin mainly acts by inhibiting the thrombin as well as your activating your antithrombin 3. Heparin exists in two forms, that is your unfractionated and fractionated. So unfractionated is the one which is derived physiologically, and fractionated is the one which is derived synthetically. So this high molecular weight heparins, they have a long tail, and this low molecular weight is formed when this unfractionated heparin undergoes a process called as depolymerization. So now, what is the difference between these two? So this unfractionated heparin is going to activate your antithrombin 3. It is also going to inactivate your thrombin. It also inactivates factor 10. Whereas your low molecular weight, it is a short chain. So it will activate your antithrombin 3. It is not that potent to inactivate your thrombin. Okay, so this is only going to activate your antithrombin 3 and it will inhibit factor 10A. The unfractionated heparin, because it has having a longer chains, it will inhibit your thrombin, it will inhibit factor 10, also it will activate your antithrombin 3. Whereas low molecular weight, it is a short chain heparin, it is going to activate your antithrombin 3 and it will inhibit factor 10. So this unfractionated heparin, you will have to give IV majority of the times, and low molecular weight can be given subcutaneously. That is why it makes it more user friendly, because if you have to give it IV every time, you will have to enter the vein every time. It requires assistance, it requires monitoring. Whereas subcutaneous, it becomes easy for the patient to take on his own also. Half-life of this unfractionated heparin is short, whereas half-life of this low molecular weight heparin is longer. It's around 3 to 6 hours. Side effects, yes, both of them will cause bleeding, osteoporosis, thrombocytopenia, hyperkalemia because of inhibition of aldosterone. And the risk of developing this heparin induced thrombocytopenia is less in low molecular weight heparin compared to the unfractionated heparin. This unfractionated heparin, the action is rapidly reversible, whereas this the low molecular weight heparin, the action is partially reversible with this protamine sulfate. So now in patients who are having renal failure, especially if the GFR is less than 30, you have to use this with caution, the low molecular weight heparin, because it increases the risk of bleeding. But because the unfractionated heparin is cleared primarily by the reticuloendothelial system, it can be used very easily in patients with renal failure. This was a mechanism of action, what I was telling you. Both activate antithrombin 3. The low molecular weight will inhibit factor 10A, whereas the high molecular weight heparin is going to the low molecular weight, it activates antithrombin and it inactivates factor 10A, whereas the unfractionated heparin enhances antithrombin action, inhibits thrombin and factor 10A. Okay, because it is having longer chains that are required for the thrombin inhibition. That's unconjugated, it is porcine sources, whereas the low molecular weight, it is synthetic analogs of certain portions of heparin molecule. It could be like, we have your enoxaparin, dalteparin, tinzaparin, etc. Okay, so this can be used subcutaneously, this mainly intravenously. Now, what are the advantages of this unfractionated heparin? The advantages would be cost is less, immediate action. We have long history of successful clinical use, and yes, it is very rapidly reversible by protamine sulfate. The disadvantage of this UFH would be IV administration. That is very cumbersome. Frequent blood tests are required to monitor it, and the risk of heparin-induced thrombocytopenia is also higher. Platelet activation is higher. So this would be the disadvantage. Low molecular weight, the advantage is subcutaneous use, no rigorous monitoring required, lower risk of developing heparin-induced thrombocytopenia, decreased platelet activation, decreased chances of osteoporosis, and is having a longer half-life. The disadvantages would be, one is the cost, high cost, risk of bleeding, yes, some risk of HIT, hypoaldosteronism, and limited use in patients who are having renal insufficiency. Heparin is a very potent anticoagulant used very commonly. Patients use this mainly for the treatment and prevention of their deep vein thrombosis. If the patient is having varicose veins, if they are developing thrombus in that, doctor puts them on this heparin so that they don't form clots or thrombus inside these veins, and if at all it is formed, it should not get dislodged and go and block the vessels of the lungs. So that is pulmonary embolism, to prevent the pulmonary embolism. Certain heart conditions, patient is having heart attack, has developed a blockage, patient might be having unstable angina, patient might be having atrial fibrillation. When the heart flutters, it can dislodge any clot and cause severe complications. So to prevent such complications, doctors put them on heparin. In stroke, to prevent the complication of paralysis, to prevent the blood vessels in the brain to form a clot, we will put them on your anticoagulants like heparin. Peripheral arterial embolism, or in DIC, to prevent abnormal blood clotting, we give the patient this heparin. During medical procedures, surgery, during the surgery, after the surgery, to prevent blood clots, dialysis patients to prevent blood clot, extracorporeal circulation to prevent clotting during procedures involving your heart lung bypass machine, cardiac surgery, etc. Medical devices like balloon pumps, your extracorporeal membrane oxygenation devices when we are applying catheters, we use this heparin. And yes, definitely in the laboratory, we use this heparin bulbs. So heparin has many beneficial effects, and we use it very regularly in the clinical practice. Okay, and these were few of the differences between the low molecular weight and the unfractionated form of heparin. Not only this, heparin comes with certain side effects also. The patient can bleed very easily, there can be bruising, there can be irritation at the site of injection, there can be unexplained nosebleeds. Sometimes the complications can be very severe if the patient is having an internal bleeding. He might have severe headache, he might vomit blood, there can be blood in his urine, blood in his stools. Patient can have a severe intracranial bleed, and there can be severe headache. Patient sometimes develop anaphylaxis, breathing problems, and I've told you heparin induced thrombocytopenia, which is a rare complication, but yes, a serious condition that can lead to severe thrombocytopenia. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.